no, sir. In fact, you are a blessing, sir. It's what we need to hear, sir. Sir, please, my question is it possible for fibroid to cause painful menstruation, as in extraordinary painful, that ibuprofen, cocodamol, sometimes this injection, is it oxytocin? I don't know. Can't remember again. When they give, it does not even curb the pain. So is it possible for fibroid to cause that kind of excruciating pain during menstrual period, sir?
Okay. Thank you very much for your question. Fibroid can cause pain during menses. Yes, it can cause pain during menses. But if you are describing excruciating pain, it may need to be investigated further, because that is looking like a condition we call endometriosis. If you remember in my picture, in one of the pictures, I showed something that I was using to explain endometriosis. Okay, look at this picture. Okay, can you see the picture I'm displaying? Hello? Okay, can you see the picture I'm displaying here?
Yes, sir. Yes, sir.
Okay. Now, these black particles, okay, they are what we call endometriosis. They are just bags of, we call them gunpowder in description. So they are just bag of like blood, okay? So that condition is called endometriosis. When you have it inside the muscle like this, we call it adenomyosis. So if it is adenomyosis, it is painful. This adenomyosis, sorry, I needed to quickly pop that call. So if it is adenomyosis, you are going to notice that it's going to be in the muscle, okay, inside the muscle like this. So that's with adenomyosis. So, but then for this endometriosis I mentioned is associated with excruciating pain during menses. In fact, what happened with endometriosis is this. What happened is endometriosis is this. The normal tissue, okay, that are meant to line the internal part of the womb, you find them outside the place they are supposed to be, okay? You find them outside. You may find them on the ovary. You may find them on the tube. You may find them somewhere here and all that. And each time the woman is menstruating, they are also shedding blood. Okay. Sometimes they are also in the lungs. It's so bad. In some terrible cases, the woman is seeing her menses and she's having problem with her breathing. I mean, lungs and all that. Sometimes it can be found in the umbilicus. As the woman is menstruating around the time of her menses, she's seeing blood coming from her umbilicus, her navel. So now, that usually is associated with excruciating pain. So if you tell me a woman has fibroid, then that can coexist with fibroid. So if you tell me a woman is having fibroid and can she have that kind of excruciating pain, we may be thinking that that woman may have more than fibroid. She may also have endometriosis along with that fibroid, which she needs to be investigated. But how do we see this thing clearly? There is something we call laparoscopy. We make a small incision from around the umbilicus. We pass a camera into the abdomen to see the whole of the abdominal organ and also the uterus. So from there, we'll be able to see the whole picture like this whole thing, how the uterus is looking, how the tube is looking, how the this one and that. Then we'll be able to say, oh, she has endometriosis, just like we have, suppose or assess that she's likely going to have. Do you understand? So that's usually what's happened. That's usually what is likely going to happen in that case. But that person may benefit from what I just said now, which is laparoscopy, to see clearly. You don't need to cut the person open completely and start. It's a minimal access surgery. Just a small incision around the umbilicus, past all the instruments, and see. On the TB like this, we are seeing, everything going on inside. So I think that's the way to handle that. So if that is the case, there are drugs we will give the patients to help reduce that level of pain. There are some drugs that we use to manage that patient that is not pain drug alone. So if she's taking all the pain drug, it may not do justice to it. So that's the way that one is.
Thank you, sir.
I don't know. Any other question, ma'am?
Yes, sir. Good morning, sir. Thanks so much for teaching, sir.
Is that clear, ma'am? Okay, thank you very much. That person can benefit from further investigation. Like I said, that laparoscopy to see what exactly, but she needs to see a gynecologist first of all to be able to make a call, a more clear assessment. So it's not just a doctor that should see that, it should be a gynecologist to be able to know exactly what the problem is.
Ibukun, is that clear?
Yes, Daddy, it is
I don't
clear,
know if there's
sir.
any other.
It
Okay,
is clear,
now,
but can it
okay.
prevent a pregnancy, sir?
Can it what?
Can that
Can it prevent pregnancy?
can it prevent yes, can it prevent pregnancy?
Hello?
Can it prevent a woman from getting pregnant?
Endometriosis.
Yes, sir.
Yes, it's associated with infertility. It is associated with infertility. It can prevent pregnancy, yes.
Okay, thank you, sir. Thank you, sir.
Yes, ma'am.
Okay. Tosin, you can go ahead with your question now quickly.
Okay, sir. Thank you, sir. Sir, my question is that I want to ask concerning a married sister. Maybe a person has been married before, so maybe one thing or the other happened, and he has not, and such a person has been having sex regularly with her husband before. So, but one thing happened, and the person have not been having sex for some years. I want to ask, maybe is there any side effects for that? Because I do hear some rumors from other people, they do just to convince someone, but I want to hear directly from you to be sure.
Please, I'm so sorry. That question, I didn't hear it completely. Can you start again? I didn't hear it completely. You see, I'm trying to straighten my hair and all that. So can you come over again? Can you say it again?
Okay, sir. I said if there is a married sister, a sister that has before, but one way or the other, maybe something happened, and she has been having regular sex with her husband before, even she has given birth to a child.
Okay.
So something happened in the way, and such a person has not been having sex with her husband for years. Is there any negative effect, side effect for that woman if she has not been having sexual intercourse with any man?
Thank you. The question is clear now. There is no problem at all with that one. Anytime she herself and her husband come together again, she will start her normal life again. So there is no problem with that. If a woman has been waiting up to age of 40 before she get married, she has never known a man, it's not a problem. They will consummate their marriage and gradually it's not a problem at all. If a woman got married before, something happened to the husband is no longer there, and she's alone, by the time she marry again, she would live her normal life. It doesn't affect anything. So all those things are information that people say around just to get you into what you should not get into. So it's not any problem.
Thank you, sir. Let's welcome one more questions before we pray. Okay, go ahead. Go ahead.
Hello,
Any?
sir.
Is
I have
it
a
Mrs.
question.
Hold on. Yeah. Any? Go ahead. Yeah.
Oh, yes, sir. Is it regular to have cramps during ovulation?
Is it what? Come again?
Is it normal to have cramps during ovulation? Like, and sometimes the cramps may be more than the regular cramps that
Yeah,
you experience during your period.
yeah, yeah. You can. It's just a minute.
Sorry, sir?
Yeah, you can have cramp during ovulation.
Oh,
So
okay.
what happened is this. When they look, let me show you this picture. Can you see this picture I'm showing you here?
Yes, sir.
Good. So this is ovary. Okay. Now, this is a egg that is growing. It's going to grow to a certain stage, okay, such that it will rupture out of this thing and get into the tube to go and wait for the sperm to fertilize it. Now, when it's extruding out of this place, the process can sometimes result to pain because something is busting. Do you understand? So
Yes, sir.
that busting can cause pain. We call it meatus march. Meatus
Mm.
march. So it can some people, in fact, is even a sign for some people to know that they are ovulating. So
Mm.
around their mid-cycle, they feel that pain, and the side they are feeling is actually where the ovulation is taking place from. So it's normal. If
Mm.
it's disturbing, you can take analgesic to take care of it. But around that time, if you are battling with infertility, you can meet with your husband around that time. You are likely going to get pregnancy around that time. But like I said, it's not 100% because what causes pregnancy is not just woman. The husband factor is also there. Do you understand? So, but
Yes, sir.
that's a good time to meet your husband if you have been waiting.
Yes, sir. I also have another question. I don't
Okay,
know if
go
this is
ahead.
kind of silly, but so is there like an indicator of how like you would know if a woman is more likely to have like twins? And is there like a way, like an early sign other than like genetic, like family history to tell if a woman is like most likely gonna have twins?
Okay. All right.